to No, back then, you know, this was just bad. And we were probably leaving ourselves wide open for that, but we never had a problem. We had one kid, he was susceptible to poison.
It is 9:08 now. I'm going to go ahead and get started. If you haven't signed in, make your way over.
Jumped on him. He looked like a little old beach ball. Bad. But it's just parents.
Meeting. Thank you all to those that could attend in person. Come join us. And everybody online that also is joining us here. I talked about the sign-in sheets. I did want to disclaim, if you have a cell phone and it's not on silent, I think you can put it on silent because there's microphones above us. And even if you think you're being really quiet, there's the phone because right there.
I know, that's why you heard me.
All right, wait, that's why we couldn't get to the door. We'll begin with some livable neighborhoods updates. I don't have much for you from the office. Just that Civic Connect, we did it last year. So basically what Civic Connect is a deep dive into our public municipal departments, offices. I have a full lineup that'll start March 11th. It's every other Tuesday in the evening. If you got a newsletter, there's a sheet in the newsletter that is a save the date. And I'll have more details about that. The newsletter that comes out this newsletter. And that's all I have for you all. Join me. There will be a RSVP because we'll be providing food, and it's also limited to about 30 people per session to maximize the experience. So, and that's all from Livable Neighborhoods. We have 2 presentations today. We're going to start with Wyandotte Behavioral Health Network. So and I'll
yeah. Good morning. How's everybody doing today? Good. My name is Christine Swenson. I am with the Wyandotte Behavioral Health Network, and so I'm going to talk a little bit about what we do. And I'll apologize, I'm a walker, so I will try to walk more up here, but I also don't want to block the screen, but staying in one spot is not my specialty, so I'll kind of move around a little bit. So just a quick show of hands real quick, because I'm going to get into some more details. Who's familiar with Wyandotte Behavioral Health Network? Okay. You? Who's familiar with Wyandotte Center? About the same. How about PACES? Anybody familiar with PACES? All right, a few more hands. RSI. Great. How about Kim Wilson Housing? Anybody familiar with them?
Oh, I'm sorry. Well, when you used to be commissioners.
We appreciate that. Thank you.
They used to work.
Yeah. Who all knew they were one organization? So that's what we're here to talk about. Is I appreciate those who raise their hand, and I appreciate those who may also know, but maybe didn't want to raise their hands. But for the vast majority of folks, I didn't see a lot of hands, and that's why I'm here to talk about this, is so that you all are familiar with the resources that we offer, and then how to get connected with us, because we want everybody in the community to know we're here. Not everybody needs behavioral health supports. Lots of people do, though. And when you need them, you don't always know where to turn. So our goal is to make sure people know about us before you need us. Because when you need us, sometimes it's harder to be able to make that connection. And then some people don't know what we do and if they would benefit from anything we have to offer. So that's what I'm here today to talk about today. All right, so who are we? So when I say Wyandotte Behavioral Health Network, or you might hear Wyandotte BHN, so who we are is we are a community mental health center. In the state of Kansas, there are 26 designated community mental health centers throughout the state. And our job is to provide comprehensive behavioral health supports within those areas. The makeup of us are a little bit different. So some might be private, not-for-profit organizations. Some might be affiliated with their local county government. Some might serve one county. Some might serve 20 counties. So here in Wyandotte County, we are the designated community mental health center. So we have that designation by the state. We are a private, not-for-profit. So although we want to call ourselves Wyandotte, we also want to make sure that we're not, that people don't confuse us, that we are actually part of the, unified government, because we are a different organization. And again, we serve primarily Wyandotte County. And we have been the designated community mental health center for over 70 years in this community. Now, when we talk about, and that is also a licensure by the state. So we are not a state entity, but we are contracted and licensed with the state to provide those services. Now, furthermore, there's the Certified Community Behavioral Health Clinic, or CCBHC. And what that is that's a national certification to be able to determine if you are a CCBHC, you are providing a certain type of service, making sure that you are providing that timely and it's accessible for all, and then doing it in specific ways. And that's important too, because that designation also comes with some different Medicaid reimbursement options, but it also just puts us at that level to be able to say, we're providing quality behavioral health services across the spectrum. And we are also now a CCBHC. We have had that certification for 3 years. And the state of Kansas has now moved into what they call CCBHC demonstration states. And what that is, that's also just another designation at that state level to be able to say that as a state, we're moving into the CCBHC system. And with that comes a little bit different working, like a Medicaid match at the federal level as well. Now, as I said, we are made up of 5 different organizations, and I'm going to go into that a little bit more in depth here in a little bit and tell you a little bit about what those different organizations are and what their focus is. And again, we provide behavioral health supports across the spectrum, which means that everybody's needs are different. And we're going to talk a little bit about the services we offer to help meet those needs, because it really is a spectrum. You have individuals who might need a little bit of help, but they're not at that severe end. The folks who are at that severe end where their symptoms create quite a bit of functional impairment. And it's all ages. We serve 0 to 99 and above. We do not have any age limits for our services. We also do not have any requirements about the ability to pay. So sometimes people might think you can only access Wyandotte Center if you have insurance. That is false. Some people might say you can only access Wyandotte Center if you don't have insurance. Also false. We accept Medicaid, we accept Medicare, we accept several private insurances. We are in the network of many of those. But we will also provide services regardless of the ability to pay, meaning that if a person doesn't have insurance, we will never turn them away. We do offer sliding scale fees, and that is based on a person's income. So there may be some folks who have a 0 liability for services based on their income, or other people might have a reduced fee. But again, biggest thing is we will never, ever turn somebody away because they cannot pay for services. So let's talk about all of those different things. So we have Wyandotte BHN. That is our parent or our umbrella organization. Thinking of it like Coke, right? You have Coca-Cola, and then you have Sprite, you have Dr. Pepper, you have all of those things, but they're all part of that Coca-Cola family. Did I get those right now? Because Dr. Pepper is a Pepsi. There you go, Mr. Pitt. That goes under Coke. And we have a president or CEO who's Randy Kallstrom. Randy is very involved at the community level, both at the local and state level. And again, that's kind of our parent organization. That's our administrative arm, if you kind of think about that. Then you have Wyandotte Center. I'm the executive director of Wyandotte Center. And what we do is our focus is services to adults 18 and over. And then you do have PACES. PACES executive director is Clarice Poder-Barrick. And their focus are on those kiddos from 0 to 17 and their families. Now, some kids might stay in services with PACES after the age of 18, but usually you need to be between 0 and 17 to start services with them. Oftentimes we will see folks get to that age where they're no longer appropriate for PACES services, and they'll transition into Wyandotte Center services. So it's not that once they reach that age, they can't have any support. They just might move over here to us. Then we have RSI, and I'm going to go into a little bit more about what we provide here in a second. RSI, their executive director is Colleen Madrano. And that is a 24/7 crisis stabilization center for those 18 and over. And again, I'm going to focus a little bit more on that here in a second. And then we have Kim Wilson Housing, and Kim Wilson Housing's executive director is Rachel Erbelding. And they focus on housing supports for those with mental health needs. And so again, we'll kind of talk a little bit more about that. Any questions? Yeah.
Do your office provide, or you just said 24-hour service? There's a situation where we keep constantly hearing inside of the media and news when a situation where the police encounter with the individual who's got a mental thing. How do you guys respond to that to assist the police department, or do you respond to that?
That is a great question. Can we go to our next slide? Fantastic question. I'm going to drop down here to crisis support. So I'm not going to go in area in order because I'm going to address what you're talking about. Yes, absolutely. There are times when law enforcement gets a call to respond to someone who's in a behavioral health crisis. If it is a known behavioral health crisis, we actually have what's called a CIT officer. And that is a dedicated CIT officer, actually under the community policing, under Captain Davis here in the back. And that officer will respond with a mental health clinician. And that is a licensed master's level mental health clinician who will go on scene as well. And they're called co-responders. So when you see that co-responders with law enforcement, that's what that means. And so that the mental health professional goes out with the officer and be able to try to provide a crisis intervention for the goal of connecting that person with outpatient services if necessary, hospitalization if necessary, or to de-escalate the situation and the person can stay in the community. They don't have to necessarily go somewhere. Maybe they just need someone that can help them in that moment to stay in the community. And that's the ultimate goal. The ultimate goal is to provide those supports so people can be in the community. What we're really looking though is to divert from jail. And so that's another thing that they'll do, because a lot of times it used to be that if someone had a behavioral health crisis, law enforcement didn't have anywhere else to go with that person. The answer was the jail. And that's not the best place for that person. That's not the purpose of the jail. So we do have co-responders who go out with law enforcement. Additionally, we partner with Kansas City, Kansas Police Department and other police departments within Wyandotte County to provide what's called crisis intervention teams trainings. That's what that CIT stands for. And what that is that's a 40-hour training that officers go through for the whole week. And the focus is on mental health. So recognizing signs when someone's in a psychiatric crisis and how law enforcement can respond in ways to help de-escalate the situation, bring the temperature down instead of bringing the temperature up that could lead to somebody being harmed, whether that's that person or law enforcement themselves. So thank you for asking that question. Does that answer your question on that?
Yes.
Since you're on CIT, how many of our officers have been trained in CIT?
I'm going to look back to Captain Davis or Major Casala.
The vast majority,
It's over 90%.
over 90%, 95%, I don't know, don't quote me,
Well,
but it's a lot.
I know that was the goal back when I was a commissioner, but
Mm.
I just wanted to know
That's
where
great.
we got to. Okay, that's great.
And honestly, of the percentage of people that aren't trained, it's generally going to be our people that are just coming out of the police academy, because we want them to, they get sort of a smaller CIT course while they're in the academy, but we don't want them to go through the full like 40-hour course until they've got a little bit of experience and kind of understand and know what we're talking about. You know, like Christine can speak to that, but have an idea of kind of what we're talking about with resources available and stuff like that. So they get it a little bit later, but the vast majority of our departments.
Well, I'm really excited about that because that's a whole lot different than 10 years ago.
Mhm.
So Kansas
That's
City,
a big amen, brother.
absolutely. And Kansas City Police Department has been a wonderful partner in this. So one, again, the dedication to sending officers through it and all throughout the command cycle. So we talk about officers, but we're also talking about detectives, captains, majors. I mean, and this is a partnership and they host as well. So it's a real partnership that goes on there and they're very heavily involved. Other police departments within Wyandotte County also send officers. So the sheriff's department is a huge support of this, and they send most of their personnel through as well. Bonner Springs police department send folks, Edwardsville, the community college, the school district, KU. So throughout. And then we also have civilians who come and participate as well. And Commissioner Biden is always been a huge supporter and comes and does an introduction every year too. So we appreciate it. While we're focused on crisis supports, I want to talk to you a little bit more about what that is. So that's one area. We also recognize that not all crisis interventions need a law enforcement response. And sometimes a law enforcement response can actually make things worse by no fault of the responding officer, but just somebody seeing somebody show up in law enforcement can also be a trigger. We also want to make sure that we are utilizing law enforcement in appropriate ways. They have a lot to respond to. If we can respond to a crisis, a psychiatric crisis without law enforcement, then that's a win-win. So we actually have what's called mobile crisis supports as well, which means that we have mobile crisis response teams that can respond in the community when someone is experiencing a crisis without law enforcement when it's safe to do so. That is also 24/7, 365 days a year. So that is always available. And how might you access this? Who has heard of 988? Good. So 988 is a crisis hotline number. It is a national number, but what this national organization has done is they have local centers that answer those calls. So Wyandotte Center answers 988 calls that originate from within Wyandotte County. So for the most part, because it's not like geolocation like 911, 911 can tell where you're at. We can't tell where you're at. 988, well, what it does is it pings the nearest cell phone tower. So if you were in a nearby a cell phone tower that's in Wyandotte County, it sends it to us. So it's not perfect, but for the most part, folks, if you're in Wyandotte County, you're going to get to us. That is also 24/7. So we have people answering those lines 24/7. They can dispatch mobile crisis from that. So if somebody calls and is in a crisis, and it would be beneficial for us to send somebody out to talk to them, 988 can get a hold of our mobile crisis responders and send somebody out. So if there's one thing that you get away from here, 988, that's really what we want to make sure people know, is because crises don't happen Monday through Friday, 8 a.m. to 5 p.m. They just don't, right? And not everybody who is in a crisis can physically get to one of our buildings. 988 is a way to be able to get access to care, whether that's talking to somebody on the phone. Probably 90 to 95% of things can be resolved by just talking to another person on the phone. But when that's not enough, we can send people out without law enforcement. Now, if somebody is actively a threat to themselves or others, that's where we're going to partner with law enforcement. But we can even have our mobile crisis go out with law enforcement if one of our co-responders is not on duty. And then, like I said, we also have walk-in crisis supports too. So we are located, Wyandotte Center is located just right down the street at 1301 North 47th Street. So we're just, I could walk there from here, just right around the corner on the block. And that's where our crisis walk-in is for adults. So within Wyandotte Center, other services we provide is we provide outpatient therapy services. And that's a lot what times people think about when you think of traditional like therapy. So we provide for both mental health and substance use, and those who have both. A vast majority of folks have what we call co-occurring disorders, which means they're experiencing symptoms of both. And our goal is to be able to treat both of them together, because oftentimes it's not one or the other, it's both of them connecting. We provide medication management. So we have 2 psychiatrists and 3 nurse practitioners that provide medication for those who choose for that to be part of their treatment plan. And we also provide medication-assisted treatment. So medication-assisted treatment is one of those things where there are medications that can help people with substances. So there's medications that can help people who are wanting to stop drinking alcohol. There are medications that can help people who would like to stop smoking. And then there are medications that can help people who have opioid use disorders. And we have recently added providing medications for opioid use disorder as part of the services we provide as well. There are 2 medications that are typically provided for that. One is buprenorphine or Suboxone. The other is methadone. We do not do methadone. Methadone is very restrictive in how you can be able to provide that. So we do not provide methadone. But Suboxone is a very powerful and safe medication for people. And we do provide that. So if somebody has an addiction to pain pills, heroin, those kind of things, that's where Suboxone is used. We also provide community-based services. I am very proud of the services we provide at our building, but that's only part of what it is. You can go and talk to somebody, you can get medications, you can get therapy, and those are very great services. Sometimes you need someone working with you in your own home environment and in the community. It's because these services, again, like I said earlier, were all intended to provide those services to help somebody be independent in the community. And that means we need to be able to have supports to them where they live, where they work, where they interact with others. So we have what's called community-based case management, which means a case manager goes out into their home and helps them with skill building in their home environment and in other community places. We have a supported employment team, and that helps people find and maintain competitive employment. Because as we know, sometimes, work has a lot more to do with our overall well-being than just a paycheck. It can give us a sense of purpose. It can give us things that we can do that don't get us into trouble, those kind of things. And that's where supported employment comes into it. We also have peer support services. Honestly, I think everything we do is important. Peer support is critical because peer support are certified peer support specialists. And what they're saying is, I've been where you're at. Let me tell you what helped me so I can help you. So they use their own personal stories to help people move forward in their recovery. And that relationship is just unlike anything else we can see, because sometimes you can tell them something that you may not want to tell your therapist because you know that they understand you at a different level. And then we also do integrated care coordination. And what that means is sometimes providers need to talk to each other. For example, we prescribe medications that affect people's physical health, especially diabetes. There are medications that we prescribe for mental health conditions that can actually result in people having symptoms that can lead to diabetes. So what happens is they come to us and we're prescribing this medication and we say, hey, your A1C level is really high. You need to go talk to your primary care physician about that. So the person goes over to the primary care physician, says, hey, my A1C is high. I need to talk to you. And I'm like, well, that's because of that medication you're being prescribed by your psychiatrist. You need to go talk to them again. And in the meantime, this person is running back and forth and not getting answers. But really what is happening is those two doctors need to talk to each other. They need to come together. And that's what integrated care coordination is. How can we get everybody who's involved in that person's life talking and on the same page so that we can provide the best care possible? So any questions about kind of those 4 categories of services? So PACES. PACES pretty much does the same thing, only for kids. So that's kind of where it comes into it. But they do the same stuff. We have therapy, individual and group therapy for youth and their families. Again, when we're treating a youth, we can't ignore the parents or the family dynamic, right? We have to be able to work together through that. They also provide community-based supports. They do a few different things that I didn't mention with Wyandotte Center. One is this SED waiver support. There are some youth who meet this criteria for serious emotional disturbances or SED, and that just provides more wraparound supports to them if they fit into that category. They provide parent peer support. So they have parents on staff who have also had children with SED to be able to provide that support to parents. They also are in the schools to be able, so they can provide case management in the schools. They can also do therapy. And I can't remember how many schools they're in, but they're in a lot of the schools in both USD 500, Turner, and Bonner Springs for sure. So again, some youth need medications to help with their symptoms, so we do provide that service. And then they also have Robert's Place. Robert's Place is a 24/7 emergency shelter. And what they do there is they provide a safe place to be for a youth who may be in crisis, but also if there is a youth who is in police protective custody and going into the JIAC facility, JIAC can refer kids there because before what would happen is a youth might be in the sheriff's department and stay in the sheriff's department for like they were taken into police protective custody maybe because of their environment, their home environment. That's not the sheriff's department would do the best they can, but that's not the best place for a youth who's had their whole life disrupted in that moment. They can actually go to Robert's place and be in a safe, supportive environment while things are getting worked out. And then they also do provide respite. So sometimes, but that's only for youth with that SED, that serious emotional disturbance, because sometimes folks need a break. Sometimes the kiddo needs a break. Sometimes the family might need a break. This is a way to get that break, and with the goal of preventing further disruption. And then they also have walk-in crisis supports available. And I didn't mention before, but mobile crisis is available for youth and adults. It doesn't have to just be adults. So if a family is struggling and a youth is in crisis, mobile crisis can respond out to that family as well. And this is also services that are provided for youth, but also foster care youth. So they will also work and provide services for those who are in foster care. Any questions about cases, services? Again, it's pretty much exactly what I just talked about, just the kids. So I want to talk a little bit about Kim Wilson Housing. So they are, again, our housing arm, and what they do is they provide supportive housing services. So they work with the HUD and get programs. And what that means is for those individuals who experience chronic homelessness, and that's defined by basically a year's worth of homelessness. There's more to it than that, but that's probably the simplest way of breaking it down. And so those vouchers help people find housing and help pay for that housing, but getting somebody in housing is only one step of that. We also need to provide supports to them. And so we provide case management supports, but we also provide housing supports in particular for the folks who are in that program, with the goal of, again, wrapping intensive services around that individual to help them maintain their housing and not continuing in the cycle of homelessness. We also have a homeless outreach team, and that homeless outreach team, one, will provide services to those who have behavioral health needs, but they will also go out and outreach individuals who are experiencing homelessness, who might have a behavioral health need, to get them connected with us. So that's another partnership with Kansas City, Kansas Police Department that also participates in that homeless outreach program too. And then we also have Frank Williams Outreach Center, which is a drop-in center available for those who are experiencing homelessness and who are also needing behavioral health supports. They can come there and get connected with their treatment team. They can also do laundry, take a shower, have a safe place to keep their belongings, especially important papers like driver's license, social security numbers, birth certificates, all of those good things. Again, with that goal of getting them connected with housing and behavioral health supports. We also have what's called an Assertive Community Treatment Team, or ACT, and that is an evidence-based model for those individuals where traditional behavioral health services really just haven't been able to help that person yet. What they need is something a little bit more. So these are usually individuals with severe mental illness, with severe symptoms. They oftentimes find themselves having frequent law enforcement contact or frequent hospitalizations. Sometimes they are not housed because, again, their symptoms kind of interfere with some of those things. So it's a more high intensity wraparound support for those individuals so that we can help them stay out of higher levels of care and stay in the community. And then we have Lester Pauls. Lester's Pauls is a transitional housing environment. Sometimes, I don't know if y'all know this, but someone can go into the hospital. So we have one hospital here in Wyandotte County that offers psychiatric hospitalization, and that's KU, their Strawberry Hill campus. That's it for Wyandotte County. And in the state of Kansas, we currently have 2 state hospitals, Osawatomie State Hospital and Larned State Hospital. If you need the state hospital in Wyandotte County, you're going to Osawatomie. That's our hospital for our catchment area. It serves multiple counties, and I think last time I heard they have, I want to say 160 beds. Not enough, not enough. And so we can go into the state hospital, stabilize, and be discharged into homelessness. It's really hard to stay in that stable place when you're discharged into homelessness. And sometimes we need something in between, because in Wyandotte County, there's not a lot of options. In the state of Kansas, there are not a lot of options. It's either you live on your own or you don't. And that's pretty much it. There's no in between. There's no transitional housing. There's no group homes for folks with behavioral health needs. And so what we did was we created the transitional housing environment to help people go to a safe place to be able to work on skills to be able to get into housing from there. It's always full. We only have 4 beds. We just started it. The outcomes are great, but we have more of a need for it because we only have 4 beds. Any questions about Hamilton Housing? All right, so as we talk about RSI, RSI is our 24/7 crisis stabilization center. It is also just across the street at 1301 North 47th Street. And what that is that is a place that people can go in lieu of hospitalization. So this is not hospitalization. I like to think of it as just a step before hospitalization. They can go there 24/7, 365 days a year. We never close, even when there was 12 inches of snow on the ground. We had staff there and did not close. And what that can happen is people can come there, stay up to usually it's 3 to 5 days, although people can stay longer, but that's the average length of stay. We have sobering beds, which means that if someone is just under the influence of some kind of substance, it doesn't matter what substance it is, they can come there and kind of sober up a little bit and then get connected to supports if that's what they want. Or they can come there if they're in a psychiatric crisis and we can help start them on medication, get them back on medication, or again, just provide interventions. We also provide groups out of RSI with the intent of helping to stabilize their crisis without having to go to the hospital, and also be able to get connected to further follow-up care. RSI was again started, so RSI has been open for 10 years now. And it was really started as also a way because it was when the old Rainbow State Mental Health Facility closed. And so that was the goal was to prevent hospitalizations or admissions to the state hospital. Apologies for that. But it was also to help divert from the jail. Because again, what we were talking about was when law enforcement would come into contact with someone with a behavioral health crisis, sometimes their only recourse was arrest to help get them somewhere where they could be safe. RSI, 25%, usually about 25% of all admissions to RSI come from law enforcement. So law enforcement, if they come in contact with somebody in the community who has a behavioral health crisis and they're willing to go to RSI, law enforcement will actually bring them to RSI. Our goal is get them in and out. You know, law enforcement drops them off, says, here's this person for you. We get them back out on the streets and then we help that person who comes into us.
Basically, it's up to the person if they want to be treated, and they can leave at any time.
That is correct. It is a voluntary only facility. So it's, yes, yeah. So that is, so if the person is not willing to stay, then we cannot hold them at that facility. But if somebody is unwilling to stay and does pose a threat to themselves or others, we can help get them to a hospital, even if they may not be willing to do that. If it's severe enough to be able to warrant that, then we can help get them to a hospital. We just can't keep them at RSI. RSI is available to any members of the community. You do not have to be a client of ours to access RSI. And again, people will never receive a bill from RSI, ever. So that's also one of the things, because sometimes people might say, I feel like I need to go to the hospital, but I can't afford that. That would be a really great opportunity for this person to come to 24/7 or to RSI, because they will never, ever get a bill from us. So any questions about RSI and what we do there? And like I said, that's 18 and over. I mean, we currently have, I think, we have capacity for up to probably 18 people there. Actually more than that, over 20 people if we count our sobering beds. So any questions before I kind of talk a little bit about how you can access our care? Any questions about what we do, or if you had a question like, do you all do this? Before I kind of talk a little bit about how you can help us or help get to us.
Yes. So if you have someone that has an issue and you feel like this would help them, they they have it's something mental going on. You know, they're an alcoholic, you know, they go together, but you have to convince that person that they have an issue. They can't hold a job, they can't do anything. And you see them down spiraling. So I tried to talk to somebody like this, and I tried to tell them, you probably need to go to Social Security because you probably, you can't work a job. You can't do this. Is that someone that you would send here, and do they refer to Social Security if it's that?
Absolutely, absolutely you can. So we actually have staff who are trained before. And what that is that's an expedited Social Security application because but you have to meet certain criteria to be able to have that. But we have a lot of staff. We help people access disability all of the time because if you've never gone to the Social Security office and if you've never applied for disability, holy moly, is it overwhelming and confusing. So we help people all the time with that. So how do you get help? So I've listed these numbers down here, and this presentation can be shared out as much as you want. So if folks need that, but essentially call us or come by. With adults, we offer same-day service. So if somebody is not connected with us and wants to be connected with us, all they need to do is show up over at 1301 North 47th Street, and our goal is to see them the same day. We actually don't schedule intakes. That's what we call that initial appointment to get started with us as an intake. We don't schedule them. We say you come in on the day that works for you, and then our goal is to get you seen that same day. Kids do schedule appointments because that's a little bit harder for families to work that out. And sometimes you might have a wait, and an 8-year-old who's having behavioral health needs, waiting in hours, sometimes hard for that person. But they do have walk-in supports. RSI, you can walk in 24/7. You will get the same response at 1 o'clock in the morning as you should get at 1 o'clock in the afternoon. There's no referrals necessary. You can be transported by law enforcement, but you don't have to be. You can get referred from the hospital, but you don't have to. You can walk in on your own as well. 988, again, if there's one thing I can't emphasize enough, 988. Because a lot of times, if you don't know what to get help for, and that's kind of where 911 was, right? Easy number to remember if you need help. We want an easy number for people to remember if they need help for a behavioral health need as well. And that's 988. 24/7 will always be answered. And then if we need to send somebody out to that person to help them, we can. And I think I have one more. Now, how to help other people. I think this is your question, right? One, like I said, know what's out there and what's available to you before you need it. When you need it, it's harder to think through all of those things. If you know what's out there before you ever need it, that's one of the best ways you can help somebody else. Look for a sign that person may be struggling. People won't always tell you. Actually, a lot of times they're not going to tell you. May not also always be obvious. So look for those little signs. Look for signs of changes in behaviors. Isolation, withdrawal, kind of doing, acting just a little bit weird sometimes. What I say is, some of those bizarre behaviors, like, I don't know, this doesn't seem like how this person normally acts. Sleeping too much, sleeping too little, eating too much, eating too little. Basically, it's something different. When you see that, ask. Don't be afraid to ask that person how they're doing. That's probably one of the most powerful things you can do. Sometimes people think that if you're worried about someone thinking about suicide, asking is going to put the idea in their head. I promise you it won't. If somebody is thinking of suicide and you asking, are you having thoughts of wanting to hurt yourself? Promise you they're not going to think, I haven't thought about that before, but that's a good point. It's not going to be there. If the thoughts are there, they're there. Asking opens up that door, and then listen to them. Because what you're doing at that point is you're creating space. Oftentimes people who are struggling, one, may not know they're struggling. So sometimes when they're having some of those thoughts, they don't know that those thoughts are a little bizarre, a little weird. They don't know that. Sometimes when someone is really manic, they kind of enjoy that feeling, that high energy feeling. They may not know there's something going on with them. But also they feel shame. They feel people are going to judge them. They might be judging themselves. What's wrong with me? Why am I like this? Nobody cares about me. Those thoughts get in their head. You asking helps break down that door, that it's okay to not be okay. And listening to them and hearing them out, not arguing with them, not telling them you shouldn't feel this way, but just listen to them and hear what they have to say. And encouraging them to get help, or at least letting them know you're not alone. 1 in 5 people in this country experience some kind of mental health struggle at some point in their lives. I would probably imagine that most folks in this room know at least one person who struggled with mental health at some point in their life. It's common. It's incredibly common. And so we want to try to break down that barrier and help them get help. And then the last thing I want to say is there's a training opportunity. It's called Mental Health First Aid. And we provide this training as well. I'm looking at Andrea, so I know a lot of folks know Andrea here in this room, and Andrea can also get anybody connected with mental health first aid as well. It's basically like CPR. It's an 8-hour course. It's kind of like CPR first aid, recognizing and knowing the symptoms of someone might be struggling with mental health and what you can do to intervene. Because some folks are like, I want to help, I just don't know how. I don't know what to say. I don't know if I'm going to say the wrong things or what's going to happen there. Mental health first aid can help. So that's who we are and what we do. Yes.
Can I just have you go back? I was just getting ready to take a picture
Oh,
of it.
sure.
I was writing it down.
Of the numbers?
Of the numbers.
Yes, absolutely. Great.
And I'll also send this out if you're, get the reminders about the meeting. I'll send out the whole PowerPoint.
Good, thank you.
What does RSI stand for?
Sure, thank you. Rainbow Services Incorporated. So when we opened RSI, like they were actually in the old Rainbow Mental Health Facility, the old state hospital there. And so we named it Rainbow Services, kind of as a nod to Rainbow. Well, then folks got confused because we were in the old hospital. Rainbow Services, they thought we were the state hospital. So we rebranded as RSI to hopefully avoid some of that confusion. But that's what it stands for. And I don't know what PACEs stand for. I would love to tell you. It's like Parent and Adolescent CES. I should have probably found that out. That's an acronym too. Yes.
Are they comparable? Like the person I know is not in Wyandotte County, but Johnson County. So is it pretty comparable what services they offer there? If they call that 988 number, there's kind of a partnership
It should be.
between you, but
It should be. So all of the mental health is the person in Kansas or in Missouri.
yes.
Okay. You know what county they reside in?
Well, no, one's in Ottawa, but one's more in Lenexa.
Okay, so Lenexa would be Johnson County Mental Health Center likely. Ottawa is probably going to be Franklin County, which might be Elizabeth Layton Center.
Okay.
So every county, so like Elizabeth Layton Center serves both Franklin County and Miami County.
Okay.
Every county has a designated CMHC, and all of us have either moved to or are being a CCBHC.
Okay.
Some of us we're in different stages of developing that, but there is help. And so the 988 call centers, the way the 988 works is we have one in Wyandotte County, we have one in Johnson County, and we have one in Sedgwick County, Wichita.
Okay.
The other ones go to either headquarters in Lawrence, Kansas, or Health Source in Topeka. So they're not local.
Gotcha.
They should be able to connect. The services don't change. They can connect. It's just not local.
Gotcha. Thank you.
Do you have to deal much with the Missouri side? Because I'm sure,
Absolutely.
because we're so close.
Absolutely. Absolutely, we do, because, you know, especially individuals who are experiencing homelessness, there aren't shelters here in Wyandotte County outside of cold weather shelter. And so we do work with a lot of folks who might seek shelter in Missouri. We also have a lot of folks who go back and forth. So we actually work with their mental health centers. Our CEO, Randy, is also part of a kind of a metro-wide group that encompasses the mental health centers from both the Kansas City, Missouri area and Wyandotte and Johnson County, so that we can collaborate and talk to each other.
Who would be the best person to contact with for Jackson County and things like that? I mean,
Sure.
just trying, because I see patients across the line a lot.
Absolutely. So Jackson County is probably either going to be University Health or SWOPE or Rediscover
Okay.
is likely who's going to be in Jackson County. And I don't know exactly, so the Mid-America Regional Council, Mark,
Uh-huh.
sometimes they have a lot of work within those.
I'll check with them and see
Yeah,
who they say.
they might,
They
they,
know.
yeah, I bet they would know better than.
Thank you.
You're very welcome. Any other questions that I can help with? All right, thank you. Thank you for allowing me to talk to you for a little bit. I appreciate it.
We do have 988 magnets on the desk out front in case anybody wants one, and there's some in Spanish if you think somebody in Spanish might need information about that. So. Okay, we do have one more presentation, and that's from Ms. Karen with Boston Daniels Corporation.
Yes. Thank you. Okay, hello, everyone. If you guys know me, a lot of you do, you know I'm a quick speaker, I'm to the point. Speaking is not my specialty, but I'll get through this. I'd like to introduce to you the Quindaro Peace and Arts District concept. We're looking for community support. This is a Boston Gateway initiative. Have you ever come into the Quindaro Northeast area and gone, it's dark, it's depressing, why would you want to live here? Well, we're trying to build a district in order to bring more funding, bring back businesses and residents to this area. Okay, so let me read this. Read along with me. We're thanking the residents, community leaders, and stakeholders that have been in favor of creating a district. And we'd like to express our gratitude for your unwavering support. As we continue this journey to revitalize the Northeast area of Kansas City, Kansas, we are inspired by your passion, resilience, and unwavering belief. This, like I said, this is a Boston Gateway initiative. My name's Karen Daniels, and I'm the CEO of Boston Daniels Corporation. Our mission is to uplift and bring sustainable development to the Northeast area of Kansas City, Kansas, while maintaining the dignity of our Black and Indigenous history. And Gateway, she is a nonprofit organization that helps other nonprofits. And she is a consultant, and she's been very helpful in gathering data and the feedback from the community. Next page. Okay, so we are here to request your support in establishing the Quindaro Peace and Arts District. On behalf of the Quindaro Peace and Arts District, we would like to formally request the designation of QPAD, a community improvement district, a CID. We believe that a CID is a critical step in enabling the revitalization and protection against displacement, which is something we hear a lot, that the lifelong residents of that area do not want to be displaced, and they don't want their property taken through eminent domain. So we have created a zoning overlay addressing those type of issues. We also want to be in support of and intentional with helping Black developers build in this area. We've heard a lot of issues where Black developers and builders have not been able to get land bank properties. They haven't been able to build. They've had trouble during the permit process. So if we can stand united, we can show the commissioners and the residents and funders that we are a united area and we deserve to have improvements brought to this area. Now, a success story of a CID, a CID is a tax which is usually 1% or less from the sales of businesses, and it would be used to improve the district. An example of a CID is 39th and Rainbow, which includes revitalizations of new homes, commercial space, their medical facility, and the quality of life for the residents there. We envision the Quindaro Peace and Arts District as a catalyst for economic growth and community revitalization in the established CID district. The incremental increase in property values and local economic activity generated by new construction and rehabilitation efforts within the QCAD would provide a sustainable revenue stream to support ongoing future development, which is something we're wanting. We're wanting to build in that area. Let's go to the next page. Now we got this directly off Groundworks webpage. This would be the district. It would include Fairfax, all the way to the Quindaro ruins, and then over to Washington Boulevard. So from the river to Washington Boulevard, from the river to the Quindaro ruins on 27th Street. That would be considered the district. Creating a district would be just an extra protection umbrella for the area against displacement and yeah, so let me continue. Okay. We are building a council. We're needing financial a council, marketing, seniors, youth, people that want to work with seniors, people that want to work with the youth, people that want to work with health and healing, policing, arts, small businesses, workforce development, and you can hit that QR code and you can sign up for any one of those councils that you might be interested in. So we do have upcoming events planned. A kite festival in April, an arts festival in July, and a Taste of Quindaro, which will be sampling some of the food that we're growing from a community garden that we're starting at one of the area churches in this area. We have our contact information. My last community engagement was Sunday. We had a social concern Sunday, this past Sunday, February 23rd. And we're going to continue to have community engagements. And you can always come to our webpage, Boston Daniels Court, to find out when our next engagement will be. Okay, you can go to the next one. So this is some of the data that we've gathered from community feedback on things that they wanted to see. Now, this is for Boston Daniels Park, and I did see some of you yesterday at the groundbreaking ceremony for Boston Daniels Park. That's going to be $1 million renovation. Those improvements are starting Monday, and they should be done by April. So we are keeping track of community feedback.
You might want to tell them that that's the biggest project that Parks and Rec has ever done.
It's unprecedented, yes.
There you go.
Never before has Parks and Rec given this much money to a park that's already been established and redeveloped. So this is the first. I'm also excited that we're not just telling history, but we're making history because we've got Ed Dwight to do the monument for Boston Daniels. They knew each other. And so we're really excited about that.
Well, this is a big thing. You can't toot your horn too loud on this one. This is really a big thing, and I think it's a great start for the Northeast area, Quindaro area, to be able to grow nuggets of growth.
Yes, sustainable development.
Yeah.
That lasts for generations. That's what we're trying to build, and that's what we're about. So these are examples of what we'd like to bring to this area. Inglewood Arts is in Independence, Missouri. You can scan that QR code if you'd like to see what that looks like. But they took an area that was deserted and abandoned, and they have created a beautiful art district. And I would advise anyone to go and visit it. It's really nice.
Yeah, it's super cool.
And it's something that we want to bring here. Art is uplifting, it's expressive, and it helps with mental health we just talked about. Another example is the Beltline in Atlanta. You can QR code that and see what they did. But the goal is to bring development to our area. Okay, you can do the next one. This is Boston Daniels Park. We were just talking about it. It's going to have, again, $1 million renovation, including a life-size monument of Boston Daniels, new playground equipment, a picnic shelter with tables, and new sidewalks throughout. We had Virio, who was our landscape design, and Parks and Recs. We're in partnership with them. And we're really excited for this work to start again. It's going to start on Monday and be done by April. This is on 8th and Quindaro.
I had one question about the CID. Why are you including Fairfax? And do you think that will help or hinder you getting the CID designation?
I think it would help because if we don't include Fairfax, we don't have enough businesses to really establish a CID that would make a difference. But if we can include Fairfax, and if Fairfax was willing, then it would be a great foundation. Like history, I didn't know that Fairfax was named after a Black man, of the first Black legislator. I didn't learn that information until I was an adult. And so we want to bring this together. Fairfax is just not off to the side, and we're all together, and we should be celebrated together. The same with Juniper Gardens. I didn't know the name Juniper came from a slave settlement, where slaves first came to this area. They settled in Juniper. They settled in that area and they called it Juniper. And that's where the name Juniper Gardens comes from. I didn't know that till I was an adult.
So you have this history all out there? Because I don't know any of those things either, so.
Yeah. This history is all out there. This is our history, Black and Indigenous. We can't be unapologetic. We have to be unapologetic about our history. We have to be intentional about bringing Black businesses and to this area, and Black developers to this area. We want to give them a chance. So this is a design concept for Boston Daniels Peace and Arts Center. It would be located directly across the street from Boston Daniels Park, where we've obtained land bank property. But we've reached a stop at that project because like other development on that street, we've been told that the design doesn't meet there's not parking available to meet the design we want to do. There's been stores that haven't been able to open because they don't have parking. There's not parking in the Quindaro area. We don't have pull-in parking like Minnesota does. But something as simple as that could change, how businesses are run on that street. So that's something in the future that we hope will come.
And that's right there across from Texas Town.
Right across from Texas Town.
The bank is split.
Mm-hmm. So this is an example of residential property that our designer came up with, Draw Architect. What we'd like to bring to the area. We'd like to bring also dual residence where you live, where you can have a business downstairs and live upstairs, things like that. So this is an example of housing. Cafe Momentum is an organization that we're trying to bring to this area. They teach young children how to be chefs, cook, farm to table meals, run a restaurant, and their youth are from juvenile detention centers where they're teaching kids from that are in troubled youth and giving them a skill. So we're hoping to bring that in. We're also talking with Art Unity Network. She is a art therapy major. There's a lot of healing to be done in this area before we can build. There's been abuse and neglect. We can't pretend that we didn't have police brutality in this area. It did happen. So we want to be able to heal. That's another reason that we're doing it through the arts. And this is the garden that we're talking about. That's going to be on a land-bank property behind St. Peter's CME Church, where we're going to grow herbs and spices and be able to share that with the community, because herbs like rosemary has a lot of healing. We can turn it into oil, teach the youth how to do that. And, you know, so that would be a good idea. And these are the people that have been working with us, and we want to give a special thanks out to St. Peter's with this land bank property offering the garden space. Chester Owens was very important in sharing all his historic, valuable information he's gathered throughout the years. Rochelle Donald, she used to be the mayor's liaison, but she's been very helpful with knowing what the community's needs, like the intimate domain and other things to protect the residents. Miss Wyatt, of course, Livable Neighborhoods, thank you. Commerce Bank has donated some to the park to help with the monument. The downtown is a district, and they're in favor of creating a district in this area. They also think that it would improve the area. Inglewood Arts, we've been in contact with them. They helped us with the zoning overlay. So even though Missouri and Kansas is different, a lot of our needs are the same. Parks and Rec, Hollywood Casino Fund. These are the developers I was talking about that's ready to build in this area. Steve Cooks and Billy, they're developers, they're ready to go. Of course, the mayor and commissioners. Matt Kleiman is wanting to partner in this area with Vibrant Health. And just, you can go down the list. There's other people. Ed Dwight, again. He was the first Black astronaut, and now he's a artist, and he's going to do the sculpture for us. So like I said, I am quick and to the point, but we're here because we're asking for support. We are going to be, we are going to be presenting to the commissioners, asking that they establish a district, including Fairfax in this area. Like I said, if Fairfax was a part of it, it would be a substantial foundation for us to develop on.
When do you go? When are you asking that?
We don't have a date yet, but I want to make sure I'm reaching out to the public first before I go to the commissioners. So is there any other questions?
One question is, Unified Government has a community neighborhood revitalization plan. Is UG providing any assistance with your surveying?
Not at this moment, no.
And then for those of you online asking, I will share out both of the presentation from before and Boston Daniel's presentation now in a follow-up email.
We have shared it with Vibrant Health, with Matt Kleiman though. And they have invited us to speak and do this presentation here. So we're just trying to reach out to as many neighborhood residents and stakeholders that we can. Get your support, make sure that you are aware before we go to the commissioners, and try to establish this district. Again, this district will just be a protection that will highlight what everyone's doing. We don't want to take away from what anybody's doing. Everyone has an important part to play. But if you are within this area, we want to support you. If you're within this area, we want to bring more funding into this area. We want to build. We want to give Black developers and businesses a chance. And that's where we are. So I appreciate you guys listening to me. Thank you. Thank you.
All right, we are going to move right into our department and organization updates. When I call your name, if you're in person, come up, introduce yourself. If you're online, unmute. And if you could limit your update to 3 minutes, that would be great. And first up, we have KCK USD 500.
Hey, good morning, everyone. I'm Marco Johnson. I'm the Director of Communications and Marketing here at the school district. Our Board of Education will be hosting a listening and learning session to discuss budget and finances regarding the school district. This will be an opportunity for to get an overall financial look at the financial health of the district. The session will take place on Tuesday, March 11th from 5:30 p.m. until 7. It will be here at Central Office located at 2910 North 59th Street. Dinner will be served, so it's important that those who want to attend be sure to RSVP, and I'll drop the link in the chat box here in a second. Secondly, we have a Power of Community luncheon coming up. This is the first annual Power of Community luncheon. The luncheon aims to foster connections, share experiences, and empower our next generation of leaders. Students from all 5 high schools, as well as our alternative facilities, will be in attendance, and it'll give them a chance to hear from some of our leaders here in the KCK community. This luncheon will take place March 31st from 11 a.m. until 1 p.m. here at the district office again. And again, if you want to attend this event, you'll also need to RSVP. So once again, I'll drop those in the chat box, and we hope to see you at both of these. Thank you.
Thanks, Marco. We have Turner USB 202. Going once. Going twice. So, KCK Fire Department. Also going once. Twice. So, KCK Police Department.
Good morning, everybody. We were having a discussion about who's coming up here. Hey guys, I'm over community policing and traffic. I do have a couple of events to invite you all out to. The first one that we'll have this year is going to be the Peace Walk, Saturday, April 12th. I think this is our 3rd or 4th year doing it. Same location, 5th in Washington. We'll meet up there with the community, and then we'll go northbound on 5th Street and march up to Mount Zion. And just walk and gather for peace. It's always a good time. We have a lot of tables out there, Bearcat gaming trailer, all the fun stuff. That's going to start at 11 o'clock in the morning. And again, that's April 12th. So we hope to see you out there. We have our women's self-defense class. I don't know if anybody's been to that or not, but it's a pretty fun class. It's at our PAL off of 5th and Armstrong. That one's going to be May 17th from 8 a.m. to noon. It's free. It's for females age 13 and older. If you're under 18, we do have to have a waiver signed by your parents, but you can register online. It's free to do. It's on our KCKPD website. And then the next one is West Patrol's open house. That's going to be May 22nd at 4 p.m. It'll be a good time. Any questions for me? Okay, thank you.
Thank you. Next, we have Wyandotte Sheriff.
Hi, everyone. Sheriff couldn't be here today, so I'm Grace Jacobs. I'm our media specialist. We just have a few updates. Opening day for the lake was supposed to be this Saturday, March 1st. There's still a lot of ice all over the lake from all the terrible weather, so we're gonna move that to March 8th. So just be aware of that if you were gonna come out and do anything, or your first fishing day or whatever. That'll be next week. As it gets into election season, the sheriff understands that a lot of people like to have their potential elected officials come and talk to their groups. So he's super happy if anybody has any groups that they would like for him to come talk about his opinions and his stances on things. He's happy to do that. And then also we're about to get into our really busy community engagement season where we have lots of events and everything. So if you do not follow us on Facebook and Instagram, please do so. That's where we post all of our updates and events coming up. So yeah, that's a good place to find out all of our information.
Did you say that the Wyandotte Lake opening day is being moved to March 8th?
Yes.
Okay.
Tentatively.
Right. Hopefully it's not the budget, but it's scheduled for.
Is the today at 2 o'clock, the
Yes,
it is, it's,
Yes.
okay.
Where they're stuck.
media days will still occur.
Stocking still at 2 today.
Yes.
Thanks, Grace.
Can you add one thing? Give me the number for the sheriff if he wants to come out to neighborhood groups.
I don't have his number, but I leave my card on that table over there and you can come. Anybody from PU?
I am here. Good morning, everybody. Thank you guys for being here. I'm always excited to be at Livable Neighborhoods. So I have a few things I'm going to discuss, mostly just, I'm sorry?
Your name.
I was gonna get there.
Oh, what's that?
I'm Nick Brennan. You guys probably know me. Original dot from around the area, so sure y'all see me around.
I don't know here.
Name is.
Nick Moreno.
Thank
Okay,
you.
there we go. So I have 3 things I want to discuss with you guys. So 3 resources that will help people connect to some dollars to help them pay their utility bills. So the first one is a federal program called LEAP. We just had some representatives come back from DC and this one is still being funded. So it is administered through the DCF of Kansas, the Department of Children and Families. So if you want to search LEAP, LIEAP, Kansas on Google, it'll take you right to the DCF site. That application is due by the 31st of March. It is a one-time payment that will help you out throughout the year. That one is, I think you have to be within 150% of the federal poverty limit to apply. It's a little mouthful there. But that one is, we know is going to be funded for this year. I know there was some confusion and with all the stuff going on, but we don't know about next year, but this year it is being funded. So you have until the end of this coming month to apply for that. And a couple of things that we have that are funded by us, we have utility assistance program. That one is income-based. It's you have to be within 200% of the federal poverty limit, and you are eligible for up to $500 every year. And that one, you can call our customer service 573-9190 to get connected, or call the United Way at 211, and they can help you find a partner organization that will get you funds. Another one that is also accessed the same way through the either United Way or our customer service is a hardship. That one doesn't have any income limits, but it is more for people who have a hardship that comes up, either loss of employment or bills that they're struggling with outside of that. So we want to help our people and we want to connect you all to services that will help you keep the lights on. So thank you all. Any questions?
What contact number do people use if they want to reach out for any of those resources that you just said?
211 United Way, or call our customer service at 573-9190. Yes.
Also, are those on your website?
On our website, yes.
Thanks, Nick.
You're welcome.
Alrighty. Mayor's office, everybody from the mayor's office. Going once. So, the DA's office.
Good morning, everyone. I'll be super quick. I could probably just sat back there. I'm Jonathan Carter. Good morning to all of you. Just a quick brief update about our office. We, during the Black History programs last month, we were able to give away 5 scholarships to deserving students, and we picked students from all the high schools, so we didn't just focus on one. So those kids can go on to further education in whatever they deem necessary. And also, I just wanted to let you know that we are available to come to your neighborhood group meeting if you would so desire. You can call me directly. My number is area code 913, of course, and the number is 573-2849. 913-573-2849. We do it all the time, and we'd love to come to your meeting. I'm good.
Thanks, Jonathan. UG Strategic Communications. We're getting through this, y'all. I was scared for a second. Okay. No going once. Next up, UG Neighborhood Resource Center.
I got it a few minutes ago. Okay. Planning and urban design. Good morning, everyone. My name is Alyssa Marcy. I'm the long range planner with planning and urban design, and I really have one announcement. So there's a flyer over on the table, but we just launched what's called a Vision Zero Action Plan. This is a county-wide effort. It's grant funded through a federal program, and essentially what it will do is we're looking at our entire transportation network, so all of our roads and intersections, sidewalks, and identifying our most dangerous intersections and what we can do to fix them. So Vision Zero is a new concept. It's trying to transition away from how we used to design streets, which is accidents are inevitable. Vision Zero instead says humans make mistakes, so how can we plan for that and prevent and eventually eliminate traffic fatalities and serious injury. So on this flyer here, it's a little bit of information about the plan. It'll happen over the next 10 months or so. But right now I have 3 things that I need from you guys. Our website is on here. It's wicokck.org/Vision Zero. And there is a giant map on the landing page of the county, and you can actually drop comments in about places that you've experienced some, accidents, and that's, you can be a pedestrian or a cyclist or, driving a vehicle. So there's different ways that you can provide comments on where you think the most problematic parts of our roadways are. So that's the first ask. The second is, I'm happy to come to any neighborhood meetings that you have or events, and provide presentations if that's something you're interested in. And then third, something that we're also trying to do is if you're comfortable and you have a story where someone experienced, traffic violence and there was an injury or fatality as a result, we're also looking to share those stories and really humanize this issue because it's something that affects everyone. So on our website, you can drop your comments there. My email is also on the website, so you can email me requesting a presentation. And then there's also an email listserv you can sign up for. And those are different ways that you can get in touch and stay updated on the project. Any questions? Thank you. Thanks for listening. The Public Health Department. Hello, everyone. I'm Zoe Woodward. I'm the Events Coordinator at the Health Department. Hopefully I can give kind of a well-rounded update this month. I want to highlight a couple of things. One, our lead program is still going strong. So if there's anyone who lives in a that meets our qualifications, so it's like an income qualification, or if there are children in the home, whether that is owner occupied or rental, please reach out to our health department. Our no lead program, it's lowercase k NOW lead, uppercase NO, like no more. So I wanted to highlight that program. And then I wanted to provide an update on some hiring. Thankfully, we are expanding our teams a little bit. So if you know anyone interested in which ones are expanding, there's some family planning positions that will be posted soon, some health educator positions that are currently being interviewed for, but I believe the link is still open. And then my part, like my program, the CHIP supervisor position will soon be posted. So if there's anyone interested in community health, or working on behavioral health, jobs and education, healthcare access, violence prevention, safe and affordable housing, then that position will soon be posted and is really exciting. And the CHIP update, the Community Health Improvement Plan is on year 2 of our current 5-year plan. So we are currently doing the revision process. So we're meeting with all of our lead agencies to make sure that our strategies are still applicable to our community and that they best describe the work that's being done. So when those booklets are finished, I will bring them and we'll have them and you can then all look at them. And we're ordering like hundreds. So please take them, share with everyone. Yeah, was there anything else that you wanted Wes to speak about? He's out sick, so I'm the stand-in.
Don't think so. If you want a copy of year 1 booklet, I have some in my office for you to come snag in case you want the comparison.
Yeah, perfect. Anyone have any questions? All right, thanks, Shelby.
And then last but not least, for department updates, we have KCK Environmental Services. Oh my God, I'm gonna fix the agenda. I lied. One more, which is Parks and Recs, and they'll be on the agenda. It's okay, it's okay. Share. I'm sorry.
No, I'm okay speaking up. Good morning, everyone. My name is Shaya Lockett. I am the Recreation Manager with the Parks and Recreation Department. A few updates, some of them have been stated already. Yesterday we had the groundbreaking for Boston Daniels Park, 7th and Quindaro. It's nearly a $1 million project. It will include a new 5,000 square foot playground, shelter, improvements to the rock work at that location, as well as landscaping and solar lights. So it's a really monumental project for the department. And that's funded through a combination of funds through ARPA and community, development block grant funding. So we work collaboratively with Boston Daniels corporations and other organizations to bring that project to life. And it's been in the works for a long time. So we're really excited. And we'll be sharing information for a ribbon cutting for that event once it is completed. Our 2024 annual report is now updated and it is online. I will send Mina the link to it. It includes all the projects that and activities and events that the department did last year. We're really trying to do a better job of sharing all the great work that our team is doing. Our team has been working really hard to add more events and activities for both youth, adults, and seniors in our community, as well as improving our infrastructure throughout our parks. So if you're interested in what we did last year, you can take a look at that report. We talked about Media Day is today. Media Day is when we invite everyone out to Wyandotte County Lake to see the lake get stocked with fish. So we are breaking the ice in the boat cove so that the fish can still be delivered. That will happen today at the boat cove at 2 p.m. at Wyandotte County Lake, if anyone is interested. And as was stated, opening day is postponed just for the safety of everyone. With the amount of ice we have on the lake, we cannot open. So it is tentatively scheduled. And as long as the weather cooperates, we think we should be good for March 8th, but we will keep everyone posted if that continues to be opening day. Last thing, or two more things regarding spring break, we are working to have some activities for the youth. So at Kensington Gym, March 18th through the 21st, we are partnering with a group called Temple Made Fitness for a free program for middle school and high school athletes that will include skills training and wellness coaching. We are looking to do some different things and to have activities for our kids. Primarily, our programming focuses on those who are 5 through 12. We've heard from the community there's a need for activities for those who are older. So we are piloting this program over spring break to see if we can garner the interest. So if you know any athletes or want to be athletes, this is a great opportunity. They work with all skill levels. But it's completely free for them. It's 2 hours. Snacks will be provided each day, and it gives them something to do during that time at Kensington Gym. And then follow us on Facebook for updates for other activities we may have. What's the time on that? 2 p.m. to 4 p.m. So anyone 12, well, middle school to high school, 12, 11, 12, somewhere. Yeah.
Date was that again?
It is March 18th through the 21st.
I got 3 questions.
Okay.
Okay. Number one, how is the planning for the Quindaro pool, Parkwood pool? Is it on schedule to be open up this year?
Yes, we Parkwood Pool we have a management contract that hires the lifeguards. They recruit year round. They have the ability to recruit year round. So they when we last met with them had 36 applicants. All of them are not certified, so they are working with them to get them all certified, but are on track to have the appropriate number of lifeguards for the season.
Okay, Bethany Recreation Center, what are your plans with that?
So we are working through some staffing challenges right now. And then Earl Watson Community Center. So
Okay, I'm sorry.
I have to remind myself that all the time. But we are working to get the appropriate staffing levels so that we can make sure that all our communities are safely operated. Historically, there's only been one person in our community centers, and we know with some of the challenges that we're facing, that's no longer a safe option for the community or for staff. So we've increased the number of staff we have, but we just have to get everyone hired and trained. And then we will get our facility.
You are gonna be opening up Bethany.
Yeah, we're working through that hiring process now, once we have all the staff on and trained.
Okay, the water park at Heathwood Park, I saw something briefly, what are you doing there?
So Heathwood is currently undergoing a renovation. It wasn't open last season. There were some mechanical, I can't get into, I don't know what all the technicals, but we weren't able to open it last season. So we were able to find funds through, I believe it was funded through ARPA. We got approval to get that project funded. And we are doing a completely new spray park there. So they are currently demoing the current spray park, and it is scheduled to be open by Memorial Day weekend with all other spray parks. So by Memorial Day weekend, there should be 2 new spray parks open for the season. Last year we did Clifton. In Clifton Park, we are redoing Heathwood now, and then we are also working on Pearson Spray. Question? Thanks, Shay. You're welcome, and I apologize. I have to get to another.
Okay, we are gonna. Okay, anyway, we're gonna move into our community announcements. If you're in person, if you just come on up, introduce yourself. And limit it to about a minute. If you're online, you have an announcement, if you would just drop it in the chat, and I promise to read it after everybody in person has gone.
My name is Connie Brown Collins. I'm with Voter Rights Network of Wyandotte County. You may know that we have an organization that pretty much keeps tabs on policies, bills, legislation at the state level that happens here in Wyandotte County. We are having an event this Saturday, the 1st. It's called Backpack Full of Cash. And we're doing it in conjunction with the school district and Judith Deedy, who follows and advocates on legislation impacting public schools. She follows that legislation again at the state level. Now, Backpack Full of Cash is a documentary on the impact of vouchers when they come into cities and impact the public schools, the public school students in those cities, and the communities. Usually they are run by big corporations, these private schools that get the vouchers for their students, and the corporations are all about money. And so it impacts our public schools by siphoning money out of those public schools to fund those vouchers. So we're offering education on that for people to take a look through that documentary. We're having a panel discussion afterward, and everyone is welcome to attend. It's going to be held at Carl Bruce Middle School off of 18th and Parallel. Starts at 11 a.m. And if you'd like the information, please sign up here, put your email address, and I will send you the link to sign up. We ask you to register because we are providing lunch after this screening, this documentary screening. Questions? I'll put the sign-in sheet over on the table.
Hi, I'm Elizabeth with Youth Ambassadors. I want to share some information about our donation drive that we're hosting next Saturday, March 8th from 9:30 in the morning until 12:30 in the afternoon. This is a youth-led project. They're focusing on creating wellness kits for the unhoused community in Kansas City. Once all the donated items that we collect, they will be later distributed in a little goodie bag in Kansas City. Right now, the items that we need are toothbrushes, toiletry items, so travel size shampoo, body wash, lotion, and also any snacks and water bottles or any juices. Again, I didn't say the location, we'll be at the Kansas City, Kansas Community College inside the CEB building. March 8th. If you're not able to attend that day, I have my contact information, so definitely can reach out and we can coordinate a different pickup time. Anything is welcome. We appreciate any support we can get from the community. Thank you.
Is that a flyer?
Yes, I have more flyers out there, and I sent you one too, if you can attach it to. Thank you.
Hi, I'm Rose with Strawberry Hill Neighborhood Association. Sorry, Rose, let me get out of your way here first. My knees are not working well. I have an attitude. Just wanted to let everybody know, because I'm sure you're anxious to know the date. Our pub crawl, our 9th annual pub crawl on Strawberry Hill is June 14th. And we also have a new web address and a new email address. It's thestrawberryhill.com. And yeah, so that's all I've got. Thanks. So sorry for jumping up and I'm so sorry. Sometimes the knees do what I want them to, and sometimes, well, what can I say? They're old. Anyway, so I'm just up here to remind everybody, because there is a little note in here about the legends of the Grand Ole Opry going to be singing out there on Sunday at Wine Center. And it's a fundraiser that the Kiwanis West is doing, because that money all goes to grants for children's education. So I just want to tell everybody about that. And it's only $25, and it's a family-friendly situation. There's room for people to actually dance. The kids come out with their family. They get out there on the dance floor and they dance too. There'll be food and frivolity. So anybody's welcome. It starts at 2:00. Thank you.
I'll be there if anybody wants to come see me.
Are you gonna be out there? Are you
Yeah,
working?
working it, yeah.
Cool. I'll see you too, because I'm working.
And my mom made a quilt, so if anybody wants to get on the raffle for that, you could win a really awesome quilt.
Thank you, dear.
Hi, my name's Karen Shivey, and I know this is kind of a little different kind of topic, but we have, I've spoken to me about it. We have family farm area, 47th and Metropolitan. There's about 2.5 acres of organic farmland that we're trying to save. The family, it's my cousins that actually still have the property. There's lots of history on it. Shawnee Indians, we bought it from them, my family, 4th generation ago, from Germany. It's, like I said, organic. It's wonderful farmland. We have a gentleman next door who wants to buy it to park industrial trucks on. So we're, I've worked with KC Farm School. I've also talked to Turner Community Garden. The problem is the trustee of the family is wanting to sell it very quickly. And so we're kind of under some time frames. So I'm just saying, if there's anyone here who knows organizations that may have links to try to set up a farming types within any of the neighborhoods that are looking for farmland, please see me afterwards. I'd love to be able to find a way to make this work. Close to Argentine, close to Turner, kind of right there at 635 in Metropolitan is the area. So I told the family members who are frustrated by the one wanting to sell it that I would say something today, kind of as a opportunity to maybe see if we could work something out. So I appreciate your time. Thank you. Thank you.
I think that's everybody. I want to thank you all for sharing your morning with me today. I did want to say, if you didn't sign in on your way in, sign in on your way out. If you want a resource guide, I have plenty to some on the table. I also have some in my office. And I will see you in March. Thanks for coming.
Yeah. Yes. Hi, I'm Janet Goose.
Hi,
Yeah.